Greetings and welcome to our webinar. Today, we will delve into a critical discussion surrounding the unique challenges and risks young Black women face in context of breast cancer. Our esteemed moderator this evening is Dr. Megan Edmonds. She will guide us through this essential conversation. And we are joined by our two distinguished panelists who bring with them expertise and insights that only they can. First, we have Ms. Anne-Marie Swatson, founder of Painted Pink Incorporated. And we have Ms. Lara, the founder and host of Reveal It All podcast. Both of their organizations we'll learn a bit more about a little later. But for now, I'm going to ask the ladies to introduce themselves to you. Let's start with Anne-Marie.
Good evening, everyone. My name is Anne-Marie Swatson. I reside in Atlanta. I am from Florida. I am Ghanaian, and I am just so excited to be here. It's one of those things where I feel like my life really propelled once I moved to Atlanta, where I started to just get my footing on who I was and what I was called to be. And that's where opportunities just opened up for me to start Painted Pink. With my own personal journey, which I'm sure we'll get into later. And so, yeah, I'm just really excited to be here. I am a huge breast health advocate. I'm, a server leader at heart, and I'm a community builder. And it's all about who you're connected to and how you can help in any small or big way.
Thank you, Anne-Marie. And next, we welcome Lara from the Reveal It All podcast. Lara, please introduce yourself to the group.
Hello, all. My name is Lara Aiyegbusi. I am the host of the Reveal It All podcast. Also, you can find me under the hashtag Victorious23 because I have been sharing my personal journey online as a two-time breast cancer survivor. So I am really excited to be here. I look forward to discussing all the different ways that we can support this community as a fellow breastie. And yeah.
Yes. Thank you both for introducing yourselves. I know we are in Breast Cancer Awareness Month, so this is a very timely conversation. And want to first start by opening up, some key people here that we've already introduced. But particularly want to start with, breast cancer survivors within our community. And particularly understanding some of the stark disparities that we see. So population statistics have shown us that at 5-year breast cancer specific survival rates, Black women have the lowest survival rates. And so some of the work and a lot of the attention in breast cancer research has been trying to understand why this disparity exists. Why are we seeing this? Because when we think about breast cancer, it's the most common diagnosed cancer amongst women. And so that's why we have this large group of cancer survivors at 3.5 million of an estimate. But we're seeing even at survivorship that Black women are less likely to survive. And so some of the things that we really want to focus and hone in on today's conversation is particularly regarding some of the risk for breast cancer around young Black women, and sort of what topics and conversations can be geared around understanding the risk, particularly for Black women before age 40 have a higher incidence of breast cancer. And so when we're thinking about some of the disparities that we see within breast cancer, we know from many decades of research that white women are historically more likely to be diagnosed with breast cancer, but Black women have a higher mortality. However, when we look at age-specific incidence rate, particularly amongst the group of younger than age 40, we're actually seeing a difference of race, where we see Black women are leading with the incidence of breast cancer more so than any other racial ethnic group. And so that's different from, the larger context of breast cancer and what we know, decades of research when we look at age. And we're also seeing the same thing with mortality as well. And so some of the first questions that we get when, showing these data is sort of, what are the leading risk factors and what can we do to reduce the risk? And so there are some, known risk factors out there from epidemiological studies that we can't change, so your age matter, and your family history as well. And also knowing your personal history, whether that be with benign or breast lumps. And so these are some commonly known breast cancer risk factors. But when we think about what can we do to control our risk, the focus really in terms of evidence-based has been centered on obesity and weight gain, looking at understanding the risk at premenopausal and postmenopausal. There's been a lot of evidence to support obesity and its link to breast cancer, as well as physical activity. And so I list some other risk factors that we can also control, like being able to breastfeed. There's been some research to support breastfeeding as a protective factor as well. And so, the list goes on. There's not one particular factor, right? There's a host of factors. It's very complex, but being able to understand, the risk, particularly in young Black women, is something that I really want to hone in on this conversation and learn more about the work that you all do, because it's less about me and the work, but also understanding the community, the navigation, and the work that you all are doing in the community to reach specific groups and to educate and advocate on why this is important and how we can work together to change some of the current disparities that I've shown in the graphics here. So I first want to start with a question. Can you tell me more about the background of your organization and the work that you all are doing, and what led to your decision on starting your breast cancer advocacy work that you're currently doing?
Sure.
I can get started. Or you want to, Lori, go. You go.
You sure?
I'm sure.
Thank you. Well, yeah, to answer that question, I kind of shared that I am a survivor. I had to pretty much prioritize self-care at 23 years old, fresh out of college, while I'm figuring out adulting, sorting out my affairs. I performed a self-exam and found my tumor. And that has really become the pinnacle that has kind of created this passion that kind of drives me to just create more awareness to my community of young Black women to prioritize their health, to prioritize taking care of themselves. And literally in my story, I kind of just share like self-care literally is the same equivalent to vitality. So if you want to live, you need to start taking care of yourself. And so I had to kind of get my whole entire life together in a very interesting way in my early 20s due to a stage 1 diagnosis that I was able to locate. I went through ups and downs with insurance companies and doctors, not thinking that originally this thing that I located myself was not something that needed to be further investigated, but with advocacy and also having really intentional care part care. I don't want to say caretakers. What would be the care team, I could say?
Mhm.
The care team that I've really individually selected to be a part of my health journey have really been huge advocates for me in my situation, locating cancer at 23 and getting all the screenings that I've needed, all of the exams that I've needed, which has really, in my story, propelled me as a self advocate to, again, inform my young ladies that yeah, this is happening, unfortunately, in our community. And I had kind of no awareness about this until it happened to me. So that kind of drove me to create my space of Victorious 23. And I use that platform, that name, as my team name, even when I perform on like breast cancer walks and things of that nature. But it stands really for the term of being victorious and identifying and locating my cancer at 23 and coming out victorious at 23. I ended up creating a space for Victorious 23 with the Reveal It All podcast, which is a space that I've created to completely tear down the barriers of disparity when it comes down to educating yourself about your body as a woman. So I really am sharing stories on my podcast and creating the space for women to understand, one, the resilience of our bodies, but also understanding key gems and jewels and hearing people's stories of how they had to take care of themselves and prioritize their self-care, and which has helped them to get over their trial and tribulations in their own personal wellness journeys. My personal testimony being cancer. And I have, you know, a community that I definitely I feel like I have built just unfortunately due to having a chronic illness. But there's good with building a community though. And I find that that's my intention with Reveal It All podcast. I found that when I was a Black woman and I was diagnosed, I was looking for answers. I was looking for someone to give me the real on what is going on with my health. What does certain treatments look like for Black women? What does it look like to be 20 and going through this? You know, there weren't a lot of answers out there, and not a lot of representation of young Black women going through this. So I felt that in my own journey as Victorious 23, I wanted to create community where someone can see someone that looks like themselves, also a place where they can get answers, and also a place where they can prioritize themselves so that they hopefully can make better lifestyle better lifestyle habits, so they can make better lifestyle changes, and understand that, again, although we are resilient, it is important that we prioritize self-care. So that's a little bit about me, a little bit about the Reveal It All podcast. I can drop all the places to follow us later on in the conversation.
Yeah.
But it's my intro for why I created my space and also what this space is about.
Thank you so much. And I feel like it's so needed. And I would like that you highlighted that, you know, coming from your own personal story, but realizing that there wasn't many resources available, you know, particularly for women, you know, going through the same experience at the same point of life, right?
Right.
Navigating college, like you said, navigating just becoming an adult, really.
Right.
And so I think that you are not only filling a void in, you know, this particular important space, but really providing a new pathway to resources and things that, you know, can be really leveraged, you know, that's needed more so. So thank you for sharing, and we will talk more about Reveal It All. So now, Anne-Marie, can you share a little bit more about
Yes,
Pink?
absolutely. So it's I'm starting to feel some parallels. When Laura was talking, I started getting some chills, and I was like, thank you, God, because I think, first of all, we've never met, right, virtually or in person. And so I'm grateful for this space, because you just never know who you can meet and how things could happen. So for my story, I was 23 and I was feeling some pain in my left breast. And and it was time for my annual OBGYN appointment. So thankfully, she initiated a self-breast exam. I honestly wasn't going to bring up the pain because, you know, at that age, you just, I just thought maybe it was normal. I thought it could have been around my cycle. You know, sometimes your body just aches and pains in certain seasons. And so she located a lump and immediately was like, hey, you know, just going through all this science jargon, like, okay, we need to get an ultrasound, a mammogram, you know, biopsy. And I'm just like, whoa. So we get everything done. It does come back up a 9. But after I'm, you know, scooted out the door, I'm starting to have just tremendous pain continuously. So I went back and I was like, hey, you know, I want to get a lumpectomy. And they were like, the insurance is actually not going to cover because of your age. At the same time, my mom's sister had just been diagnosed with triple negative breast cancer. So it was the first time where I now understood this is in my family. So it was a very, very emotional, stressful time. And that's when I started to understand what advocating for yourself looked like. I was like, I want this lump out of me right now. I asked my parents to help me pay for it. We did, you know, an outpatient surgery. I think it was like 4 weeks of recovery. And I decided to go to a support group. I went for people that had lumpectomies and mastectomies, and I was the only brown girl in there. Everyone was over 50 and they were white. They were so confused while I was there, but I just wanted to understand because for my peers, my friends, I'm naturally just a more private person. I kind of wanted to explain to them like, hey guys, like we don't talk about breasts a lot, but like if you find a lump, like go to the doctor. But I didn't know I needed some support behind that. And when I went there and I heard, you know, these women's stories, I was like, well, what would happen if I was 23 and had breast cancer? Because if I was given this much resistance and I, you know, it was benign, but I still had to push to get this surgery, what would that look like? What does their support look like? There's nothing on Facebook. Back then, you know, we only had Facebook. Instagram wasn't around. It was just very alarming. If you Googled, you didn't see any Black or brown women. And so I started off with just painting my nails pink and walking in different, you know, large scale nonprofit walks and, you know, donating as a third party individually. And then sometimes collecting some money from my friends to donate as well. And then when it came to 2013, I was like, you know what? I'm going to just get together my own friends and family in Atlanta and share my story. And I was able to find 2 young breast cancer survivors. They were older. They had been diagnosed in their like early 40s, but they still could connect to me and what I was trying to push, you know, with younger women. And it was just such a beautiful day. I privately funded. I used I'm in the talent acquisitions. I used my bonus commission to pay for it. I just wanted people to come. I didn't want anyone to have to worry about donations, nothing. And people did leave donating some money for me to give to American Cancer Society. Because as I said, at this point, this should just be like a one-time thing. And there wasn't a dry eye in the room. And they're like, this is so needed. And all these different stories about lumps and scares and just things that people had like just, you know, hidden. And I just felt like such a lightness and a release in the room because I don't know why we carry so much when it comes to fear of health and fear of questions. And then there's also just this gap of trusting your medical care providers when it comes to us as well, which leads into a lot of the barriers that we, you know, kind of initially spoke about with the PowerPoint. I read on the American Cancer Society that 46% of women do not go back to the second appointment after there has been an initial, you know, concern or diagnosis. So I'm just thinking, okay, if people hear I have a lump, but then they hear it's going to cost XYZ, I'm not going. Who's going to watch my kids? I don't have insurance. The list goes on. I don't trust them. They don't look like me. It's probably nothing. And then when they go back, now it's a stage 3 or stage 4. And now it's much more complicated. It's much more aggressive. And this is what's contributing to our survival rate being lower, right? It's very alarming that there's a 99% survival rate to get past that 5-year remission if you're able to catch it in the early stages. And the fact that we're not Black women, we're not in that number is devastating. There's just so much I don't understand about that, you know, being in this body of, you know, pursuit of trying to figure this out 10 years later. And so, you know, after that day and seeing the confirmation and affirmation within me, that's when I decided to make it an established 501c3. And we have had, you know, 10 big charity brunches. That's our biggest fundraiser of the year to get everyone in to just celebrate life, bring in young, you know, millennial women of color to share their stories. And we've been able to partner with local hospitals to give care packages. We do this holiday giving in the Christmas time for, you know, women that are, you know, receiving treatment that need extra funds for their bills and gifts for their, you know, their family. We, have a caregiving campaign for the caregivers that I feel like they're often, misrepresented or forgotten about, to support them as their lives have drastically changed, to help their loved ones that are fighting this disease. And we do a myriad of other things that are kind of under the bucket of, like, we call it a purposely pink lifestyle, which is just about optimal health that Laura was talking about as well, which I can get into later. But high level, that's really what we are. We're kind of a duality. We focus on, just this embracing women that are going through the disease so they don't feel alone, and building this survivor community of mentorship, where we have, young Black women bringing on newly diagnosed women with that one-on-one to just talk about the things that they're not comfortable sharing, and also the life after cancer, like them building that as well. And then the second piece of us is focusing on just how we can meet our women where they are, where they don't have to eradicate what they're doing day to day from, the food they like to eat or the products they like to, use, but just educating them about, hey, if you can just infuse small changes into your lifestyle. We're not saying throw everything away and, get super strict or be a vegan, but if there's little things you can do, you can radically change the structure of your life, right? And that's all that we can do. I think if you educate in a way that's palpable and digestible and that doesn't feel overwhelming, scary, knowledge can, I feel like, trump fear. And when we can do that, the confidence of taking care of yourself is the best, because no one can take care of your health except you.
Right. Yeah, I totally agree. And so many gems have been dropped. Thank you both for being here and sharing your wealth of knowledge, not just knowledge, but the work that you all are doing too. I know I stand in solidarity with you all. I think, together with researchers, scientists, medical clinicians in the field, we're all team one. We're all working towards the same goal. And I love hearing about the work, particularly in the advocacy groups that you all are leading and connected with, because that's really where the heart of the work is, I believe. And, being on the ground and, having those one-to-one conversations with women. And both of you mentioned, the importance of really advocating for your health and what that looks like, right? Because not all of us have that personality where we will do that in the doctor's room, or like you mentioned, Anne-Marie, there is this sense of medical mistrust. And this is something that we've known historically for quite some time, within reason, right? Due to some of the historical events that have taken place. So I want to sort of pause there and talk about some of the programs that you all do related to the advocacy on breast self-exams. Both of you highlighted the importance of that and knowing your body, knowing your normal, month to month. I'm not sure if either of you were doing breast exams early on and then notice a change in your breast. We know that there are guidelines for breast self-exams, and there's been some controversy around that, right? So it's not necessarily required, but it is recommended. So can you both talk about that? I know you both mentioned it briefly in your introductions, but talk more about the work that you are doing around breast self-exams, also mammograms, because we know regular mammograms is what will be needed even after breast self-exam if something is felt. In order to confirm, your mammogram will still be needed. So any comment there?
I can speak to on my platform where I use my voice using my podcast. I just use it as a space to educate. So I have a few episodes that I actually just released where I kind of just spell out things to look for when you are just checking yourself out monthly or just checking yourself out in the mirror, And as far as self-exams go, I can speak to my experience. I performed them, but I started to take them probably more seriously after like maybe 2020, 20s, in my teens, when I first started like my cycle, and we were in sex ed class. I knew nothing about how to properly perform a self-exam. And I think also culturally too, for me, I come from a Nigerian household where we don't talk about body health things, boobs. No. Those conversations are, often had in private. And oftentimes, again, I've realized just as a woman, you don't really find out what is really going on in even society and in the world until someone else shares their story. And you're like, wait, that happened to you too? Like, I can relate. We see each other. So I definitely feel that that happens a lot in womanhood. Like, even as I learn and I look forward to one day procreating, that's a whole different chapter of tips, wisdom that others have, that I look forward to, sitting down with women that have experienced certain things and sharing with me, okay, how can I best prepare myself for this? And so I find that as I walk as Victorious 23, I'm always leading with that message. And I always speak to that on my podcast as far as like education goes. Like, how can I make this relatable so that you guys can also get like, yeah, it can be maybe a little bit tedious to do the extra work. Yeah, you might get some anxiety because you don't have all the answers, but that's life. We have to kind of tackle our fears. And I also share on my podcast, like, these things, we can call them beast, but we can tame a beast. You can live with the beast, you can conquer a beast. All these things can be handled. So I often just share a lot of educational things to just be mindful about on my podcast. And self-exams is something that I stand by because it is my personal testimony that has saved my own life. Literally finding my tumor, being proactive about it when I found it, like not waiting. That's a huge thing that I share with my community. Don't wait. Just get the answers that you need. And then you can make some decisions once you get some answers. But I just highly advocate for my community of young women, especially Black women, to just learn your body, spend time with yourself. And that's what my podcast really just explains.
Yeah, thank you, Lara. And can you share? I know you have mentioned the name Reveal It All podcast, but where can people find and access the podcast?
Yes. So if you land on just the homepage, which I'll spell out the URL, if you listen to your podcast on Apple, on Spotify, on Castbox, I'm on all those platforms. Okay, your girl is working hard over here. So whomever is looking for community, you can type in Reveal It All podcast in your search engine on any of your streaming platforms. But if you have any trouble finding me, you can search podcasters.spotify.com/pod/show/reveal-it-all. I'm also on Instagram. You can follow me at Reveal It All Pod, POD at the end. And you can find me on my personal social at As Told by Lara, and I'm on Instagram, Twitter, all the things, TikTok. But yeah, that's where you can find the podcast. And I would love, love, love for any support. If you have a story that you are interested in sharing, or if you are looking for community, I always just open myself up to, again, be a vessel, because again, I've learned through my experience, it's really aided a lot of others in their journey. And the more that you share, you honestly, you find and you meet other like souls that really do need that information. So I'm a vessel on my podcast, and that's what I see it as.
Yeah, absolutely. You really are. So thank you for sharing. And I didn't know if Anne-Marie, did you have something to add, or I could?
Yeah, I can answer the question about the program. So
Yeah.
I think I talked about the care kits that we partner with local hospitals too. We also send those out nationally. Those have clean beauty products in them. We have recipe books in there. We have a custom journal that we made. The journal was curated by several, I think about like 40 different women of color that had gone through breast cancer, and they basically answer questions from how do they handle their natural clothes coming in, how do they date after a cancer, how do they have those conversations, how do they tell their loved ones and their jobs, like, what worked for them, what didn't work, how do they like to be served by other people that wanted to care for them in that time, because not, flowers can make some people nauseous with chemo and radiation. There's things that, it's hard to kind of talk about how you want to be shared and in that space. And so the journal is just such a great way for people to read. And it's honestly for anyone to read, but the specific stories are so compelling and kind of meant for while you're kind of, going through chemo and you're kind of sitting there to be able to kind of read and journal and what have you. So it's like a intentional journal that kind of guides you through. You even have podcasts in this, and I know we got it when our next 2024 version, we know what we're going to add to that. Reveal It All is going to be in there for sure. We just have different places for them to be able to just feel seen, right? And we just compound everything together. So that's a body of work we definitely want to get published and share with other women that have nonprofits as well, because we realize like sometimes you put all this work into something and it's like it's not getting out as much as it should, right? And then on the Purposely Pink side, we put together our programming for Purposely Eat, which is focusing on women of color chefs putting together these cooking shows and showing like different ways to just like transform how you eat. Purposely Fit is working with different, women of color trainers to just show about fitness. And, that also gives us a space to work with corporations. We just did one with Microsoft, which is really cool. They did yoga and event with us. So that's the way to kind of just get all different type of people together to just get our bodies moving and, just the power of moving your body every day. And then Purposely Beat is our third program under Purposely Pink, which is we love all things makeup and, beauty products and hair products, but do we really know what's in them, the carcinogens, the parabens? And so just getting a better understanding of like what you're really putting in your body goes into your bloodstream. And so just like really talking through those pieces so people can take the little bits to make better health conscious choices, right? Of, just clean products. I think that's pretty much it on like all the programs that we do. And our last program would be called our Shower Her campaign. This is a special program that is on kind of like an as needed basis. It's for women of color that are diagnosed with breast cancer and find out during their diagnosis that they are, they're pregnant, and during their pregnancy, they find out they're diagnosed with breast cancer. As you know, when you're pregnant, your breasts have so many changes. And it can be very confusing, especially like when your milk is coming in, you're already having a lot of lumps. And I don't know why, but that is a time where you can kind of bypass it. But if you know yourself and know something's off, that is, where you be able to locate tumors, if you will. So partnering with them to just put together these baby showers for them have been so gratifying, because I just can't even imagine already with the hormones already, how emotional you are, how tough that is. So, you can actually still get chemo while you are pregnant, which is going back to the resilience of bodies, right? And so that is one of our most near and dear programs to our heart, because it really is an as needed basis, but it's just so unique, and it's really powerful.
Yeah, it sounds very powerful. Thank you for sharing a wealth of, support and emotional support, as well as tangible things that you do through Painted Pink organization, and thinking about some of the things that you mentioned on diet and physical activity, right? Thinking on how important those are and critical, and reducing risk of breast cancer, but not only risk of breast cancer, but also improving survivorship, right? And a lot of our women who do have a history of cancer, there's many evidence-based science that shows that does support and provide many benefits metabolically, to the body. And so I loved hearing about the diet and the physical activity. And that's something that I think, in particularly within Black community, that we all, are striving for and wanting to change, because some of the disparities that we also see within that context. And so I know that you both are, working and discussing these topics with your networks. And so I just love that, we're all doing the same thing, obviously, but, in a unique way and telling that story. And I want to make sure that people can, in our audience, find where you are with Painted Pink. I know you're located in Atlanta, Georgia, but in
Yeah.
terms of virtual worlds, how people can locate you.
Yeah, so virtual world website is www.paintedpink.org. And then for our Instagram, it's paintedpink4BC. And our Facebook is Painted Pink, then spelled out SOR, breast cancer. So those are our three biggest ways to directly reach out to us. Instagram messaging, like DMing us, is a great way. You can always email us as well. The emails come directly to me. And then our CMO responds to every single DM. We're very, very active, and we've been able to connect. I think the pandemic was such a blessing in disguise because it forced us to stretch to, reach so many other people and not be so focused on like our physical presence. And
Right.
It allowed us to be really creative of how we were connecting with people. And it enlarged our territory, if you will, which is really cool. So there's a lot of people still looking for us in these type of conversations.
Yes. Yeah. And thanks for saying that, because we also on our end saw the benefits when the pandemic came to change a lot of the programs actually to online, to have this webinar online, right? So that it can be translated and disseminated to larger groups through social media. So it has opened up many new opportunities, and the power of technology, and something that I really love about both of you in the work that you're doing, is really feeling the need of the virtual presence out there in breast cancer, and the discussions that are being had on young Black women as well. So, Lara, the podcast, I know there's not that many podcasts out there in particular, so you really are one of the first. So, what are some of the upcoming sessions, topics that you're going to, be discussing down the road?
Yeah, what an exciting question, right? I'm really excited for this space. Can I just first say that's why I can't keep this smile off my face. I feel like, as I shared in my personal health journey, it propelled my awareness with my own body. It propelled my awareness with womanhood. Here I was at 29, you know, making the decision to do IVF. These are things that I never thought I would be doing at this age, but have definitely been blessings in disguise. And as I go through my journey and I meet other warriors that are not just going through cancer, but also just going through other women wellness, health related issues, or just have other chronic illnesses that they're combating with their bodies right now, I just have learned that the story behind a survivor is kind of similar, where in all cases, no matter what the illness or the disease was, there's something that kind of sparks within you where you decide, I want to live and I will do anything by any means to get well. And so I feel that when I speak to women, and again, I hear these stories, I'm like, this is powerful stuff. So expect conversations that will go in depth about my personal journey, the things that I've gone through, as I shared IVF at 29. But the reality is, we are in a generation where 20-year-olds and 30-year-olds are considering saving their eggs, So I kind of, again, had to propel and expedite myself in these decisions due to my own personal health journey, but it created a bunch of awareness for me with my body and being a woman. So I'm going to be talking about that. I also will be definitely guesting some of my doctors that have been amazing individuals in my own personal journey. They're already knocking at the door, like, I'm already ready. So whenever you want, I will be on the show. And I really take a lot of pride in my care team because, again, as I shared, I individually like found these people. It was a very intentional decision for me to find people of color as individuals to take care of me in my time of my most vulnerable state. And thankfully, I found the women that supported me in this journey prior to my diagnosis. But again, it all kind of just fell into just a wonderful place for me because they ended up being individuals that I can trust, that I care about. So, and that cared about me. So they too will be on my podcast for sure, where they will share their insight as doctors, their insight dealing with patients. But again, the conversation for the most part on the Reveal It All podcast is really just to share the stories of the resilience of our bodies, encourage women to not wait when they find things that doesn't sit well with them, encouraging women to understand what their normal is for their body. And we're observing it all together. Like I'm now 30, and there's many other things that I look forward to exploring in my life. So as a survivor and also in our survivorship, that brings on a whole nother layer of awareness and things that I now really hone in on compared to, my 20-year-old self. So it really is just a space where it's growing with me, with my health journey. I'll be sharing those things, but also informing my listeners on how they too can take care of themselves and advocate for themselves with the insights that are shared on the podcast.
Yeah, thank you. I believe in the power of, knowledge and, just sharing more about information and resources. And so want to make sure we highlight that for some of our audience, and same for you with Painted Pink. I know you all recently had an amazing brunch that you all just hosted and, have future reoccurring annual events. And so just highlighting, some of those that you would like to share and some of the community events that are coming soon.
Yeah, so this year the vision was commemorate, just like pausing and just celebrating where we've come. Next year, I hear God telling us partnership. There's so many people in this space that we can ally with and just get a bigger voice, combining our networks together to just, propel our individual visions, but collectively it's the same. We just want more people to live, more people to understand what this is all about and empower them. So I'm really excited for, seeking those partnerships. We already, sought out some amazing organizations, and I'm just excited to build on that. So, whenever we get that, I'll be able to really share. But in terms of ending this year, we're just going to start preparing for one last volunteer drop to get our care kits for the newly diagnosed patients that we've been able to find out about through some of our local hospitals, and get that out in the next couple of months. And then by end of December, we'll definitely be doing our, holiday giving to recipients. And so, getting those applications and everything in. So that's how we'll be kind of closing out the year. And then, as I said, next year is all about still continuing our Purposely Pink programming and our care kits year round, but really trying to shift. After 10 years, I feel like there's kind of like a resurgence, a renewal of just how we're going to, show up and be disruptors. We are just disruptors on the status quo, disruptors on how we are talking about breast health and making sure we can just be in different rooms that, and creating tables that necessarily weren't thought of us, but we're making sure we're there to make sure we can lobby and, fight for the people that, the voiceless. So I'm really excited.
Yeah, absolutely. Thank you for sharing. And both of you have highlighted a lot of work that you're doing. Just, a wealth of important programming and, social support that you're providing to the community. And just thinking about along those lines, this is literally my last question. I threw that question in there. But just wanted to make sure we did highlight the work you're doing. But along the lines of emotional support, being diagnosed with breast cancer is an emotional time. And so what are some of the key recommendations or key coping strategies, or even just, services that you recommend to women who are recently diagnosed or who are going through breast cancer for the first time?
It's definitely a very emotional time during, before, and after. And so I find that, again, community has really been super helpful for me. Really understanding what I have to deal with and seeing that in my community really aided me to process this all. Um, I definitely encourage those that have been newly diagnosed to definitely be wary of the internet. um, my doctor definitely encouraged me to stay off of Google, but I would highly encourage to find community, find a fellow person that has gone through the diagnosis, and be careful about the questions and what you also receive as insight from others as well, because moral of the story, as we all know this, everyone's body is different and everyone's diagnosis can be treated differently. So it's important to just understand that as you look for community and you ask maybe a survivor, okay, what to expect with chemo, what to expect with XYZ, you just take it with a grain of salt. But I found that for me, again, in a space where there weren't a lot, I was like, I need to speak to another fellow that has gone through this. And I felt more informed with them. And again, I shared I had a really fantastic surgeon who really equipped me with a lot of information and resources that she already had. And that kind of just dominoed into other areas of my life and my journey just by having her as a resource. So, again, it definitely is an emotional time, but I encourage deep breathing. I encourage getting answers. And I encourage, again, just prioritizing yourself no matter what the situation may be. It's important to just, at this time, kind of stay still and focus on you. And so that self-care element is something I stand on. And yeah, I think that that's kind of where I land with that.
Yeah, thank you. That's so important. Yeah.
Yeah, I just have a couple of things I would add. Self-care and self-compassion. I think it's okay to not be okay. For example, at the brunch we just had on Sunday, a couple women that were newly diagnosed. They literally have been diagnosed for 2 or 3 weeks and were invited by their breast surgeon to come just to see the community that could be there for them. And some of them loved it, and a couple were like, I don't want to be a part of this community. I'm sad. Like, I hate that I have to go through this. I don't even know what I'm about to expect. And they'll come around when they're ready to come around. But I loved the rawness of that, right? I loved that this felt kind of like, I don't know who I'm going to be after this, but I'll never be the same, right? And I think that resistance, like, I think that there's a difference between when a change is coming and then also transformation. But I feel like either you can transform and transfer, or you'll stay where you're at, right? And I think that's kind of an interesting thing of like embracing could take, maybe we can get some professionals here, maybe we need some therapy, do whatever we need to do for your mental and be okay with that. I can only imagine pairing, therapy along with everything you need with your, health care team and then your family and friends. Those could just be the greatest things you have to get those tools that you need. And so, that will help you articulate what you feel like you need on those really hard days. And that will help you persevere, and have I feel like a lot of it is that mental, right? To say, I can do this. I'm going to push every single day through this, right? And I just think that's the most important part. Self-compassion. Number one is community. I mean, that could be like a whole billboard, but community if you don't have the mental strength, you won't even have the strength to ask for community or the confidence to get there. So doing what you need for yourself every single day, I think is really important.
Yeah, absolutely. I agree with both of you. Community is number one, just like you just said. And, having the compassion for yourself. I love these recommendations. And things that you're all saying, and you all are doing the work too. You're providing the community, you're starting initiatives and programs so that there is the opportunity to have this. And along those same lines, kind of thinking about some of the work that we're doing, I do want to highlight some of the current research projects that we are leading. We are really wanting to connect with the community part, right? So having a breast cancer survivor partnering with a newly diagnosed woman with breast cancer. So this is a study right now being led by Dr. Vanessa Shepard across different sites, and it's Sisters Informing Sisters, and women who are eligible should contact the study research coordinator at the number and email there. So you all can definitely share this with your networks and we can make sure you have it, but we just want to highlight just some of the current work and collaboration that we are doing currently. And any Black woman who has been diagnosed with breast cancer, based on certain eligibility for this particular breast cancer study, is also an important opportunity if you are interested. So just wanted to highlight that there. I also want
Dr.
to.
Edmonds, sorry, hate
Yes.
to interrupt your flow. Just want to add a little bit of information about this program. There have been a couple of themes that I've noticed that both Anne-Marie and Lara spoke to that this project in particular also speak to. So I jotted down a couple of notes. So one is no watchful waiting. That's what we call watchful waiting when, I'm just going to see what this is. We'll see later if it is something I need to check out. Also, being your own advocate. Both of them, very young women, had to learn how to advocate for themselves. We do that in this project, as well as there was one last thing, taking care of yourself. So with this particular model, with this project, the creator or the PI of the project, Dr. Vanessa Shepard, developed a model called the Talkback model, which is talk, T for talk, tell your story, A for ask questions, L for listen attentively, and know for knowing your options. And while this is a randomized clinical trial, those who would be interested in participating can also click there's a QR code, and I'm pointing at it like you can see it. There's a QR code you can scan on, and it will send you to our team members, and we can get you more information about the study, determine if you're eligible.
Right. Okay.
Yeah, that's it. Oh, one last thing, Dr. Edmonds. Laura is wearing a t-shirt that I'd love to know what the words are. So I think those people watching the webinar we'd be remiss if we didn't see the words on her t-shirt. So let's see.
Dear Cancer, I think you underestimated my strength.
Love
That's
it.
right. Yes. I do love that shirt. That is nice.
I actually got it this year at Essence Fest at the vendor Message in a Bottle, which I believe is Atlanta.
That's amazing.
Yeah.
She's Marilyn. We've partnered with her a few times.
Marilyn.
She's given us so many shirts. Yes, Marilyn. She's so sweet.
Yes. And I saw this, could not resist, and obviously so appropriate. So
yeah.
Well, now I'm gonna ask her for some of these for us. So thank you for that.
Take a screenshot, girl. Got you.
So, okay, before we end today, I just wanted to have some parting words of wisdom. You all have shared much knowledge with us and some of the important resources. We thank you for sharing and for being a part of our Breast Cancer Awareness Month for this webinar to talk more about the risk of breast cancer, particularly in young women. So for this quote, your happiness matters, and taking several times for yourself is not a kind of selfish saying, only you can take care of you. This resonates deeply with our conversation today. This resonates with the topic for today and the importance of knowing your body and the importance of having self-compassion and along the lines of also having a community and a network. And I want to thank both of you for being a part of my community and my network. All are standing in the gap, working in breast cancer prevention field together. And so in any way I can help sustain and support your initiatives for Painted Pink and Reveal It All, please, please, please let me know. And we can definitely work. And so we'll end on that. And also, if you have any last parting words that you would like to share for our webinar, please share this time.
I'm just so grateful to be a part of this. This is wonderful.
Yeah,
Thank you.
Thank you. Yeah, that was exactly what I was going to say. This has been a pleasure. Thank you for inviting me. And for those that will watch this, if you are going through anything, I highly encourage you guys to connect with us, with Painted Pink, with Reveal It All. Again, for me, I'm someone that kind of likes to talk, but I also am a private person, and I get, again, how emotional this process can be if you are someone going through this or if you have a loved one going through this. So community is vital. Please feel free to reach out to me and to Painted Pink. I feel like this community has been really influential into my journey. And again, if you aren't ready to talk about it, you can listen to it. Listen to my podcast.
Yeah, absolutely. Many and multiple avenues. So thank you again for that and for sharing. And, I think we can conclude there.